Name is Sitch. I am the knowledge broker with the Center for Studies in Aging and Health, and we manage the Age Friendly Ontario Outreach Program with funding from the Ministry for Seniors and Accessibility. We are so pleased today to co-host this webinar, Barriers to Digital Literacy for Older Adults, Bridging the Digital Divide with Elder Abuse Prevention Ontario. So thank you everyone for being here today. Rhiannon, could I have the next slide, please? As we begin, I'd like to acknowledge with deep respect the traditional ancestral territories of the Anishinaabe, Haudenosaunee, and Huron-Wendat nations, where I join this meeting from in Kingston. We are all stewards of the land we are joining from across Turtle Island, and I encourage you to learn about the original caretakers of the land from which you join this meeting. We're standing on land that carries the footsteps of people of Indigenous ancestry who have been here for thousands of years. I am so thankful to share, learn, collaborate, play, grow on these lands as we work together in our meeting today. Miigwech. So we can move on to our next slide. If you're new to the webinar series, we do mute participant lines to help us reduce background interruptions, but please feel free to post comments or to ask questions in the Q&A and chat boxes below. There will be a few minutes at the end of the presentations today for us to have a discussion and ask questions. We're very fortunate to have Chelsea and John here as our ASL interpreters, so thank you to them. The webinar will be recorded and shared with additional resources over the next few days. And you'll see that if you need it, the closed captioning is available for you as well. Following the webinar, we will have a short evaluation link that we'd like you to fill out. It's so helpful for us to see your feedback and to help hear what you'd like to see us do in the future for webinars. Can I have the next slide, please? As a reminder, there could be some personal stories that come up as you're listening to the presentations today and maybe throughout the question and answer period. We do ask that you keep your questions to general questions, and if there's something that's more specific, that you reach out to either one of our organizations for a confidential conversation. May I have the next slide, please? On this slide, I've included just a little bit of information about the Ontario Age-Friendly Community Outreach Program. At a very high level, we're aiming to build knowledge, to exchange that knowledge, and to build community capacity while increasing awareness about age-friendly communities. If you have any questions or thoughts about age-friendly work, please don't hesitate to reach out to me. I will put my email in the chat in just a moment. I'll now pass the mic on to Rhiannon with a warm thank you for co-hosting this event with us today.
Thank you, Cheryl. For those who have not seen our past webinars, I should say, just let you know a little bit about our organization. So Elder Abuse Prevention Ontario really strives to ensure that all seniors are free from ageism and abuse, where your human rights are advanced, protected, and respected. We work under the Ministry for Seniors and Accessibility that funds the Ontario Strategy to Combat Elder Abuse, which has three main pillars, which is education and awareness, public education, which includes the webinars that we do here today. We do training for frontline providers, and we also work collaboratively with our community partners to increase the coordination of services to improve our response and support for older adults that might be incurring abuse of in their homes or in their situations. And we have consultation services that we also provide support to agencies and seniors and families as well. So it gives me great pleasure to introduce our speakers today. Beginning the presentation will be Dr. Robertson. So Dr. Robertson is the research coordinator for the Center for Studies in Aging and Health at Providence Continuing Care. Sorry, just trying to move my slide. So Dr. Robertson completed her PhD in health quality in September of 2024. She holds also a master's degree in kinesiology. She has experience working on and leading a national and international multidisciplinary research projects, and currently instructs at a university level on healthy aging and research methods. In her role, she supports and coordinates research and evaluation activities in aging and health care services, So we are so pleased to have Madison here today for our presentation talking about digital literacy. Following that presentation will be our speaker from Connected Canadians, which is Ken Roy, and he's a general manager of Connected Canadians. And Ken oversees the team at the organization, ensuring the staff and volunteers are fully supported so that they can best provide digital literacy training and support for older Canadians. He also engages in Connected Canadians partners, maintaining healthy relationships and ensuring the smooth delivery of workshops and other services to boost the digital literacy across Canada. I've had the great privilege of working with Ken in the past for webinars, and you may have attended those, so we're so thankful to have you again on this important conversation today. So I'm going to turn the presentation over to Madison to start our presentation today. So thank you both.
Great, thank you so much for that introduction. I was having for a second internet issues, so please someone let me know if you have any difficulty hearing me or my slides. All right, I'm just confirming that you can.
Yeah. Yes, it's fine.
Slides. Thank you so much. All right, so as Rin very kindly introduced, my name is Madison, and I am the research coordinator at the Center for Studies in Aging and Health. I am also just finishing up my PhD and a teaching adjunct at Queen's University. For today, we're going to be focusing on a few different things pertaining to digital literacy. So we're first going to start by talking and discussing what is digital literacy and why is it important, especially for older adults in our communities and across Canada. And then we're going to dive into and discuss the key barriers to digital literacy for older adults and strategies to mitigate some of those barriers. And then finally, we're going to talk about the tools and resources that we can use to help mitigate some of those barriers, which will lead really great into Ken's discussion as well. So while digital literacy is very essential for everyone in today's technology-driven world, it's particularly crucial for older adults. Right now, there's not one universally agreed upon definition of digital literacy. However, it's usually used to describe the skills that are required to use the internet, information and communication, and different technologies. And so it can be generally understood as an individual's ability to find, understand, communicate, and use information effectively through digital devices and technologies. Now, for older adults, digital literacy often extends beyond mere technological proficiencies and includes both understanding and adapting to new technologies, but also overcoming barriers related to age-specific physical and cognitive changes, as well as some of the barriers related to the socioeconomic aspects that can limit their access to digital technology and tools. When we think of digital literacy, typically people initially think of using things like smartphones and devices, but there's actually a number of different technologies and examples of digital literacy. So these can include using a smartphone to call a family member, but can also include internet navigation, so online learning, reading the news, and accessing online courses. It can also include emailing messaging, so using messaging apps to stay in touch with friends, as well as accessing healthcare. Being able to schedule appointments and using telehealth services is also very important. And then finally, using personal monitoring devices. So something like a medical alert device for an emergency would also fall under digital literacy. A really great example is going back to that accessing healthcare. This directly relates to kind of a subset of digital literacy called e-health. And it refers to the health-related electronic technologies, specifically things like the internet and personal monitoring devices in the one area of digital literacy that's related to health. And so e-health literacy involves the ability to seek, understand, and apply specifically health information from electronic sources. And for older adults, as the individuals age, they become in more need for having not only digital literacy, but also e-health literacy. And so as our digital landscape continues to evolve, marked by a widespread adoption of smartphones, social media, online services, and the use of technology, understanding how digital literacy is important for older adults, both how it's defined, how it's applied and used, is more important and more critical in this day and age. And so in Canada, we have a very diverse and aging population. Digital literacy. So in Canada, we know that internet use among older adults has increased around 32% back in 2007 to 68% in 2016 and continuing to grow. However, there's along with that growth, there's also important considerations specific to the barriers and facilitators to digital literacy. Now, there are specific individual benefits for older adults when it comes to an increased digital literacy. The first showing that research has shown that older adults who are more digitally literate have improved quality of life. They're also able to help maintain independence and live at home. It's helped with keeping people connected, which results in decreased loneliness and social isolation. It increases knowledge, both about individuals' own health, but also about numerous other topics and interests. It assists with healthcare access and also helps with the self-management of health. The advantages of digital literacy for older adults are very numerous, and with improved digital skills, older adults can gain better access to essential information, including information about healthcare resources, and can strengthen their social ties to others, which improves their mental and emotional well-being. Engaging with those internet information and communication technologies can also stimulate cognition by offering access to games, news, educational information. And this can help both with cognitive, physical, and social health as well. But we also know that digital literacy for older adults is crucial not only for the individual, but also for broader societal and systemic reasons. And so first, digital literacy is a social determinant of health and well-being. Without it, older adults face exclusion from essential services, things like telehealth and government portals. They also face exclusion from civic engagement, things like online voting information and community programs. And so having improved digital literacy helps close the digital divide and also helps promote intergenerational equity, ensuring that older adults aren't left behind as society becomes more, moves increasingly online. It can also help foster connections between generations, reducing ageism in our society. Now, digital literacy also encourages economic participation. So older adults are consumers and contributors to the digital world, and improving their digital literacy enables them to participate more fully in things like e-commerce, online banking, and even remote work. Digital literacy also supports aging in place by giving older adults access to smart home technologies and online resources. And with that, it allows older adults to access things like reliable health information and telehealth services. And this actually helps reduce the unnecessary strain on our healthcare system. And then finally, digital literacy can help support public health goals and system sustainability. And what I mean by that is by enabling reduce avoidable hospitalizations, emergency room visits, and transportation, making our health system more sustainable over time. Now, with all of these great benefits, there are also a number of barriers to digital literacy. Our team did a scoping review looking at previous literature within the last 10 years on barriers to digital literacy and came up and summarized all of the research with these 7 main barriers. We're going to be going into more detail for each of these barriers next, but it's important to remember that despite the overall high internet use across Canada, there is still a significant divide among older adults. And these barriers are a direct influence and a result from this digital divide. Now, the first barrier related to health. Health barriers are a significant factor impeding older adults with digital technologies. So evidence from the research shows that older adults encounter health-related barriers, including poor motor skills, visual and hearing difficulties, and physical impairments, which makes it more of a challenge to engage with digital devices. There's also specific conditions such as arthritis and cataracts that further complicate the use of computers and the internet. And then also cognitive impairments like memory loss and forgetfulness can also add another layer that makes accessing and using digital devices more difficult. There's also barriers related to support networks. So we know that support networks are essential in shaping older adults' ability to engage with digital technologies. However, many older adults lack the significant social support from family, friends, or community services, which can then make accessing digital literacy and knowledge more challenging. Having a dependence on younger family members for learning new digital skills is not always feasible or reliable. So things like negative interactions with family and friends or a lack of patience can actually reinforce feelings of inadequacy and discourage use. The absence of family or social networks also can make it more difficult for older adults to engage and learn about digital technologies. And that social influence is very important. So having negative social influences or negative perceptions about digital literacy from family, peers, and those close to you can de-influence older adults from engaging with technologies. The third barrier is related to convenience and use. And so the design and interface of digital applications are very important for the usability of older adults for digital technology. So things like small font size, poor sound quality, multiple authentication requirements do pose significant barriers for older adults. This is because a lot of these complex interfaces fail to account for the physical and cognitive changes that we talked about with the first barrier and that many older adults face. And so some of these design flaws that don't take into account these changes make it difficult for older adults to navigate and use digital services effectively. Another aspect is continuous updates and changes in digital devices. So this can create additional challenges and hurdles for older adults, causing confusion and a loss of confidence pertaining to their digital literacy. And that constant evolution of technology, while important, without the proper training and education can be overwhelming and create another barrier for use. The fourth barrier is knowledge and information. So the ability to effectively use digital technologies is very dependent on the knowledge and information available to older adults. And so a lack of digital literacy among older adults can be related to the gap in computer proficiency and knowledge. A lot of times this is actually directly related to limited use throughout their lifetime. Depending on when you were born, a lot of older adults did not grow up with advanced technology, making it challenging them to acquire new digital skills later on. Now, many older adults are also unaware of available digital technology services and their benefits. So a lack of knowledge about what's out there, how they can access it or get information about it, further limits their digital literacy and use of these technologies. The next barrier is quite big. It's split onto two slides, mostly because it was the largest barrier that actually came up in previous work, with a lot of different subsections that kind of all contributes to perception barriers. And so perceptions and attitudes by older adults and by society as a whole is a significant barrier towards digital literacy. So first, there's a lot of concerns about online security and privacy, which deter older adults from considering the use of digital technologies. Many older adults fear privacy breaches, distrust in digital platforms, which also prevent them from engaging with the technologies. And this fear is particularly pronounced among rural residents who express significant worries about breaches of privacy and confidentiality. Now, beyond privacy concerns, there's also fear and anxiety around technology use, which often can stem from broader security issues. Reports of online scams, along with fears of identity theft, have heightened many concerns, leading many older adults to avoid digital engagement and digital health services altogether. There's also low self-efficacy and motivation, and this can impact older adults' engagement with digital technologies. So some of the research shows that older adults lack confidence in their ability to use things like telemedicine and other digital tools. And this is related back to some of those physical challenges like poor eyesight and memory loss. Negative perceptions of aging and technology, as well as a lack of perceived need for those technologies, also contribute to that low motivation and engagement. Some older adults even have beliefs that they are too old to learn these new technologies, or that digital tools are unnecessary for them, and therefore digital literacy is not prominent in things that they believe that they need to engage with. Continuing with some of those perception barriers, another perception barriers includes low educational level and financial concerns, to which intensify a lot of the fears that we just discussed. So previous negative experiences with technology can result in feelings of inadequacy and stress, further creating a barrier to engaging with these technologies. The adoption of digital technologies among older adults is often hindered by concerns related to social isolation, stigmatization, and threats to independence. So some older adults fear that a reliance on these technologies could actually lead to reduced human interaction with others. They're worried that it will replace physical activity or social engagement. And the use of assistive technologies can also sometimes lead to stigmatization. Older adults express that they might be feared as being labeled as dependent or frail if they use some of these technologies. And then finally, many older adults prefer traditional methods of communication, such as letter writing or in-person consultations, especially when it came to healthcare, instead of those digital interactions. They valued the personal connection and didn't believe that that could be obtained through digital technologies. And this results in low demand for things like telemedicine services, as well as the perception that face-to-face interactions are more effective than digital interactions. The second last barrier that prominently came up was resource barriers. So access to and the affordability of digital technologies are a critical challenge that hindered some older adults' ability to engage with digital tools. Limited access to digital devices and the internet was a significant barrier, and that included things like poor internet speed, insufficient storage space, and a lack of necessary equipment like smartphones or computers. This was even higher for rural residents, particularly who struggle with a lack of reliable internet access, which is critical for things like connection, telemedicine, and different aspects related to digital literacy. Resident facilities or long-term care facilities often also lack necessary infrastructure to help facilitate digital interaction and digital literacy. So again, long-term care facilities lacking the tools or reliable internet to facilitate an increase in digital literacy. There's also issues with affordability of digital devices and internet services. So the high cost of devices, the maintenance of those devices, and indirect costs also created barriers to digital literacy for older adults. And then finally, the absence of personalized training and ineffective teaching methods. So going back to that knowledge barrier, not having rigid or non-tailored instructional approaches that aren't specifically tailored for older adults and their needs or the barriers that they face often limited the digital literacy for older adults and resulted in things like frustration, disengagement, and a lack of confidence. Now, the last barrier to digital literacy for older adults, what is specific to barriers for special populations. So there's certain special populations that came up that encounter unique challenges and further complicates their ability to achieve digital literacy. These populations included visually impaired older adults, deaf and hard of hearing older adults with chronic conditions, those with cancer and their caregivers, and older adults with disabilities. Now, there's a number of different types of barriers for these individuals. For example, visually impaired older adults often lacked an awareness about the potential technologies to promote independence and reduce loneliness. Municipalities often frequently lack the expertise and capacity to provide adequate training to these individuals in order for them to have the skills to use digital technologies effectively. For older adults with chronic conditions, they were more likely to have low self-efficacy and a lack of trust in their own ability to use digital applications, and this resulted in less digital literacy. And then older adults with disabilities, for example, educational attainment plays a significant role in the likelihood of digital literacy and using digital technologies for older adults with disabilities. However, those with lower education levels and those with language barriers had significant barriers in accessing digital literacy and using digital technologies. Now, that was a lot of barriers, and there are a significant amount of barriers to digital literacy for older adults. However, fortunately, there also are a lot of strategies to mitigate those barriers for digital literacy. It's important to remember that while digital literacy and technology barriers have been reported separately, as I just did, there is a complexity and interplay between these barriers. Many of the barriers don't exist in isolation, rather they work together to create difficulties for older adults. I just gave the example where knowledge and information is a barrier. However, there's also physical barriers that influence individuals' ability to gain and access knowledge, as well as barriers with perception that influence or are influenced by individuals' physical and cognitive challenges. And so it's important to understand that when you have strategies to mitigate barriers to digital literacy, you're targeting barriers not as individual barriers by themselves, but also looking at how they interplay and influence each other. And the strategies that we're creating to help mitigate these barriers hit on or take into account multiple barriers that older adults may face. And so the first strategy to mitigate barriers is collaborative learning. And so this involves encouraging peer support and intergenerational monitoring programs. So for example, having older adults connecting with elementary school students to build confidence and skills. It includes leveraging family members and what are called warm experts, such as staff in care facilities, to provide personalized assistance. It also includes partnering with non-peer groups, so local organizations in the community, to offer collaborative learning opportunities where individuals can learn from people of different expertise, skills, ages, demographics. You can also leverage university and student-led programs or care facility programs to improve engagement and outcomes, and hold digital literacy sessions in accessible community centers to reach a wider audience. All of these collaborative learning strategies can be used in order to bring forward more accessible and also a diverse group of individuals. The second strategy to mitigate barriers is structured content for training sessions. So this includes partnering with community-based programs and library sessions that improve formal digital training, incorporating what's called gamification. So having activities with elements of game playing like point scoring and competitions, and having more hands-on activities have been shown to improve training and education for digital literacy for older adults. And then finally, implementing digital health literacy programs and knowledge sessions specific within your community in order to empower and help older adults gain confidence in their ability to use digital health services. The third strategy is related to technology-facilitated self-learning. So having specifically self-learning education and training for digital literacy through user-friendly designs, step-by-step guides, observational learning, and competency-based programming. So having the ability for older adults not only to engage in training with a group and at a facility, but also self-learning that are user-friendly and going back to those barriers, account for the different physical and cognitive changes that may occur as an individual ages. It's also important to have to support self-exploration with assistance available when needed. So when providing self-learning opportunities, having that assistance or support in the back end, if older adults do need it, has been shown to be very beneficial to mitigate some of those barriers. The fourth strategy is having tailored interventions. So again, providing personalized home-based training that caters to individual needs and abilities of those involved, given the wide berth of barriers and challenges that many older adults may face. Having adaptable programs that accommodate the physical limitations and different learning paces that older adults may experience. And also using digital literacy workshops with user-driven content. So going to the older adults within your group, within your community, and understanding what their specific needs and barriers are, and using that information first to then drive the content within your workshops, training, and educational sessions. The fifth strategy is using adaptive tools. So again, using simplified interfaces and devices that are easier for older adults to navigate have been extremely beneficial in improving digital literacy, and also providing adaptive equipment like stylus pens, larger keyboards for those with fine motor skills challenges. Now, these are two examples. However, going back to there's numerous physical, cognitive, and mental difficulties and barriers that older adults may face. First, understanding what the older adults within your community or group need and what their barriers are, and then bringing in adaptive tools that are specific to those individual needs is most beneficial. And then finally, providing continuous support. So ensuring that there's ongoing engagement through follow-up sessions and providing refresher courses can help, especially with the barrier where there's consistent changes in the technology, which can make it difficult for older adults to keep up with some of those changes. So providing refresher or updated courses can really benefit for that barrier. Establishing help desks or online communities to offer continuous support, and also creating a supportive learning environment that reduces those fears and anxiety and helps build confidence over time. So those 6 strategies identified on the previous slides can be applied by individuals, groups, organizations, and programs, anyone who's interested in increasing digital literacy. However, there are steps that specifically an individual can take as well. And so if you are an individual looking to increase your digital literacy and reduce those barriers, you can get started by first identifying your needs. So what do you want to learn? There's a lot of digital technologies out there. Are you interested in things like email, social media, video calls, health services? Then once you know what you need, choosing a learning method. So again, looking back at how you learn best as an individual. Would you prefer in-person classes, online tutorials, family support, or self-paced learning? The third would be once you know the learning method, then finding the right device and tools. Choosing a technology device that you're familiar with or that you want to use, and ensuring that there's accessibility settings that fit your specific needs. From there, you can start with the basics and build confidence. Having short practical sessions work best to start, and this can again go back to choosing your learning method, whether you want to have in-person classes, find some online tutorials on how to learn how to use that device and your specific need, or looking to family members. But again, even if you're engaging with family members and peers, starting with short practical sessions and the basics, and then moving upward over time is most beneficial when building confidence. And then always remembering to get support when needed. So consider attending refresher sessions over time and asking for help, and also looking to outside of your regular support system, whether that's family, friends, or a specific organization, and seeing if there's other support programs out there online or within your community and municipality that could add to your support network as you're continuing to grow and becoming more digitally literate. And so before we lead into the next presentation, where Ken will be discussing one of the great resources for digital literacy, I did want to mention that you are able to scan this QR code, and that'll lead you to our digital literacy page with further information and resources, as well as an infographic we have based off the information from this presentation. You can also reach out to, as I just mentioned, local libraries, community centers, senior centers, and municipal governments for more information and resources in your area. Even if you already have a good connection and support system, it's always good to see what else is out there as you continue to grow. And then I also want to mention that our team is also working on, I've said at the very beginning that there's not one universally agreed upon definition of digital literacy. And so this year, our team is working on doing a Delphi study that will actually work towards having a better understanding and consensus on what digital literacy is for older adults. And what that'll help us do is, if we can conceptualize and understand what exactly digital literacy is for older adults within the context of Canada, then we can better facilitate and tailor our programs and interventions to reduce those barriers and create a space that can better support digital literacy for older adults. And so in the meantime, if you have any questions, you're welcome to email me, and please feel free to join our distribution list for the center. And I really appreciate you taking the time to listen to me today. And so our next presenter, Ken from Connected Canadians, is also, I just talked about some tools and resources, but we'll dive into a great example of some of these resources and how to access them for digital literacy. So thank you so much.
Wonderful. Thank you so much, Dr. Robertson, and thank you to Elder Abuse Prevention Ontario for having me. And that was a wonderful presentation, and so much covered about the importance of digital literacy for everyone, including older adults, as well as some of those barriers that many face. And I'm eager to talk to you folks about Connected Canadians. So I'm just going to share my slide deck here. But again, I do want to thank everyone for having us here. One moment. Perfect. There we are. So a little overview of Connected Canadians and who we are and why this ties into Dr. Robertson's presentation. Connected Canadians is Canada's leading digital inclusion charity, focused on making sure older adults across Canada have free help with technology, training, and support. Our definition of older adults is 50 and up. So our mandate is to make sure anybody 50 and up across the country can pick up the phone and call us toll free and get paired with a friendly technology mentor who can help them learn at their own pace and try to address some of those barriers to digital literacy for older adults. There's a number of slides here, or logos here on our slide. They kind of represent the importance for us with partnering with so many senior focused organizations across the country to make sure we can support as many people freely with technology training and support and digital literacy. Just one moment. I'm going to reshare here because I want to make sure sound is active. There we go. I've got a quick video here that I want to show, which kind of is just a compilation of testimonials from some of our clients that kind of gets you thinking about all the different things people are calling us for help with every single day, and really how they feel when they've worked with Connected Canadians.
Today I attended an event with Connected Canadians, and they're an organization that helps to pair tech-savvy individuals with older adults like myself.
Then I brought out my little phone and they showed me how to send a message, which I hadn't known how to do before, and take a picture.
I'm going to ask you questions, about how your session went.
Oh my gosh, I learned so much on my phone. Now I know how to go on Facebook on my phone. I know how to send pictures on my phone.
Perfect.
And I get so excited because it is not easy for a senior.
Oh, that's a wonderful idea. Really wonderful idea, especially it's free.
Perfect.
We share what we know. You learn from us, and we can learn from you all the technical things, the modernized world.
It's helping you do things.
I want to learn. I want to keep learning.
Perfect. We set up your email today as well, right?
Emails and
Sending pictures.
oh, and send talk on it.
There's all that fun aspect, and it helps you connect with people.
When you come here, you learn more, and everyone is so nice.
Twitter? Yes. Those are some of the things that I learned.
Today I learned how to use the Google.
Especially for getting blind people familiar with Android phones. This is definitely filling a niche.
Oh, well, the main difference is that the volunteers are helpful.
Perfect. That's fantastic.
Yes, we have to connect. We need it now because that's the way the world's going.
I wish that everybody had access to something like this, because we do really want to learn.
They can always stay connected and to fight isolation and to always kind of like learn new skills on technology. So this is something that we strongly believe at.
Today
All right, so I'm going to talk a little bit about some of the different programs and services we offer. One of our main charitable activity that we want to make sure anybody 50 and up can access is our tech helpline that's designed to pair folks one-on-one with our trained technology mentors. So we have people all across the country calling us every single day or emailing us if they have the ability to do that, going on our website and also booking sessions there. And many of our partners are sending referrals to us on a regular basis. We have a team of coordinators who, have those phone calls with folks who call us and find out where they're at with technology, what kind of device they're working on, and what kind of help they need. And we work to find the right technology mentor to work with them, either virtually using screen sharing tools like Zoom or Microsoft Teams or FaceTime, or meeting in person in public locations. And our technology mentors for this tech helpline, we've trained over 550 technology mentors through a very rigorous onboarding process and a vetting process to make sure that clients have the best possible experience. Our volunteer lead has preliminary interviews. We require vulnerable sector checks, professional reference checks, government-issued photo ID, and they go through many hours of onboarding modules and even have to pass an evaluation role play session with one of our senior volunteers who plays the role of a client. So we know that everyone we're pairing understands so many of those barriers and has the communication skills to make somebody feel well supported and to help them learn at their own pace. Through one-on-one support, we've also put a lot of work into helping healthcare organizations across Canada to help ease the burden that providers who are setting people up with video conferencing tools or, using digital health portals. And we've worked with a lot of healthcare organizations to provide that additional one-on-one support. And through the pandemic, we also helped a lot of families and volunteers who were in healthcare organizations and isolated and needed help connecting with loved ones. Some of the other ways that we make sure that older adults across Canada have free help with technology training and support is through digital literacy workshops. We have 22 different workshop topics, and we're always developing new ones like phishing scams or online shopping and banking. We've done a lot of these workshops actually with the Elder Abuse Prevention Ontario, as Rayanne mentioned, and for many, many organizations across Canada. And it's a great way for folks to join in sort of either a webinar format or even in person, where we have our workshop facilitators located. We also have dedicated handouts that all participants get that help them kind of have a summary of the workshop topic that they learned on. We have a virtual art tour program that we offer through the National Gallery of Canada, where we help seniors and older adults navigate their website and explore all the exhibits they have online. We offer employer-sponsored volunteering to corporate organizations who have wonderful employees who want to give back to the community and want to give their employees meaningful volunteering opportunities. So we've trained folks from Best Buy, Deloitte, Adobe, many other organizations who then end up working one-on-one with our senior clients. We recognize even that access to technology is a major barrier that was identified as well. So we want to try to make sure we can help as many folks who don't have access to technology receive devices. And we've worked with dozens of partners to distribute thousands and thousands of devices across Canada to make sure that folks who don't have that access, and even access to cellular data for folks who don't have internet in more rural locations or are lower income and can't afford some of those high costs of having ongoing internet access. We've worked with a lot of major organizations to make sure seniors have that customized experience in learning new types of technology-related tasks and objectives. We work closely with TD to develop an online banking curriculum designed specifically to help older adults learn how to use online banking tools. And we have that in workshop format. We've trained some of our most trusted mentors to help folks learn that content in a one-on-one setting. And we also have comprehensive video and document resources on our site for ongoing learning for our clients. One of the ways that we help more and more folks learn is by offering organizational volunteer training. We've trained thousands of staff and volunteers in many organizations that are senior focused across Canada to make sure they have the skills and ability to help seniors learn. And so we've done that with municipal libraries like Markham Public Library, Baycrest Hospital in Toronto, Families Canada, and even Rogers Communications, who we trained 2,000 of their technicians who were installing internet and cable to make sure they could learn from us, how to deliver senior-focused customer service when it comes to technology mentorship. And we're currently developing our own cyber safety first aid training and certification program to make sure folks and trainees across the country know how to keep themselves safe, keep older adults safe, and also help older adults who may have been victimized by scams or other cyber threats online. Talked a little bit about Rogers. I did want to mention that we do have a waiver process that all of our Connected Canadians clients will sign a waiver that helps them understand the liability involved in working with Connected Canadians, and our coordinators will help walk folks through that process. Lastly, I just want to talk a little bit about how we sustain ourselves as a charitable organization. We are constantly working on government and community foundation grants to help us bring in funds to continue operating our tech helpline free of charge. We also have some revenue generating services like our workshops or Train the Trainer that we offer to other organizations who will sponsor those workshops or training, which helps us bring in funds to allow us to sustain ourselves. And our whole goal is really to just make sure that all Canadian seniors have access to free technology training and support. One of the best ways that we help so many local senior focused organizations is through grants like the New Horizons for Seniors grant. That's one of the great ways that we can help organizations apply for grants, get funding so that they can build a digital literacy program with Connected Canadians' help, whether that's access to devices and training for volunteers and staff, workshops, both in person and virtually, to make sure folks can learn on a variety of our topics, and increase access to our one-on-one tech mentorship program. So there's a number of ways that folks can reach out to us. I'm going to put a little bit more about this into the chat. We have a toll-free number here on the screen, which I will put in the chat as well. And you can call us, leave a voicemail, or send us an email at info@connectedcanadians.ca, or go on our website here at connectedcanadians.ca and navigate to the programs page. So I will put all of this into the chat for everyone. And I will also check out the Q&A and see if there are any questions there that I can answer. But I just want to say thank you again so much to EAPO, Age-Friendly Communities, and to Dr. Robertson for that wonderful presentation earlier.
Thank you both for your great presentations, and so much to take in, I think, in terms of all the content that you both covered and the programs that you offer. So there are a couple questions that did come up. So just as Ken just finished, made the first question, there was a reference in the video about an individual who was visually impaired, and just wondering how your organization helps in that regard.
Yes, great question. We have a number of volunteers at Connected Canadians who kind of specialize in accessibility features that devices have, which enable people who might be blind or have other impairments, whether they're vision, hearing, motor control. And so we have folks who, work with organizations like CNIB for folks who experience blindness, and they know how to address some of those impairments. So we'll have mentors meet with folks either in person, and some are even able to guide folks virtually, starting over the phone and helping them if they're in a rural location where we don't have a Connected Canadians mentor present. They can even guide folks over the phone on how to use some of those accessibility features and how to make their device work for them.
Great, thanks. There was also a question, I'm not sure who this might be. Do you also help with the distribution of how medical devices, as you also stated, as alarm monitors?
Yes, so great question. We haven't directly gotten into medical devices, but we have worked with Amazon to distribute hundreds of their Echo Show smart speakers, which are fantastic in situations where people may have, experienced a fall. And we've installed these devices in retirement communities where people can then, communicate with your device and make a call to somebody in an emergency situation. But we haven't worked directly with medical devices just yet. Although I know that we want to do anything we can to help folks. So it is definitely a possibility that we will in the future.
Great, thanks. There's just a comment that somebody else that does research at a college, and she just said that her research showed that the barrier to special populations like Indigenous populations on reserves don't even have the infrastructure to receive internet, as their towers are not available for receiving signals. So I don't know if you have any information or more knowledge on that, Madison?
I did see that comment, and I think anecdotally, absolutely have heard very similar things. I think it's very telling that there's actually not a lot of research done on those populations and some of those barriers, and certainly is a very large gap that needs to be addressed both within the community but also within research, not to exclude those populations as well, and will be a goal for us moving forward to include those populations, but also encouraging others too as well.
Great. Someone else was just asking, or go ahead, Cheryl.
Oh, I was just going to say that there's been a couple of questions about sort of what the older adult means in the research, and then there's one that sort of pulls out older adults who fall between 50 and 60 years old and those who would be over 70. And I was wondering if you could speak a little bit to sort of what those differences might be with people's digital literacy.
Absolutely. So within our research studies, we were using 55 and above as the cutoff. Now, some studies did include individuals who were younger than that, but as long as the average age was above 55, they were included. The reasoning behind that, so we typically a lot of times go off the World Health Organization, which uses around 60 and above. However, we wanted to be a bit more inclusive. But we did actually look at some of the differences. So it was about 1/3 of the research was on 55 and above, 60 and above, and 65 and above. But there's only one study on individuals 75 and above specifically. So going back to your comment is, we know that a lot of these barriers are related to individuals aged 55 to 75. However, there is a gap still in 75 and above. Within research, we called like the old adults age group. So a lot of these barriers were for individuals between the ages of 55 to 75. There still were individuals in those studies who were 75, 85, and 90, but specifically looking at some of the gaps for 75 and above, there certainly are additional challenges, especially when it comes to declining in physical and cognitive health for that population, and there needs to be a bit more research in that area as well.
Great, thank you. Somebody was just also asking, maybe this is a Ken question. So the barrier of fear. So we do a lot of presentations on frauds and scams, and computers and AI and all that good stuff out there now. So the fear of having a stranger have access to your computer can be really hard to overcome. Are there ways to talk to an older adult to encourage them to sign up, and how to convey just the need to trust? Like, do you have any comments on that? There's a last question in the Q&A.
Yes, that's a great question. And all of our technology mentors at Connected Canadians are trained to never take control of folks' devices, and also to talk to folks about the importance of really being very vigilant when allowing anybody to take control of their device. We at Connected Canadians only do that in very rare circumstances where people kind of sign off and maybe they have motor control issues and can't complete certain tasks on their device, but we only seek to guide folks and have them share their screens so that we can see. But we're also training our mentors really on focusing on how to guide people to avoid sharing personal information even with our mentors, because the importance of keeping personal information private is so important in today's age, where there are so many bad actors out there. But we also don't want people to be afraid of everything that they're doing online. We want them to build their confidence and to make them feel more vigilant, but also more secure when they're performing regular everyday tasks. But it's a great question, and I always want to make sure people know to be vigilant if they're ever giving control of their device to anybody that has requested that, and we certainly won't be doing that without their explicit permission at Connected Canadians.
I see a few questions just about how people can access the recording. I want to remind people that both organizations will send out links, and we will have the PowerPoints and the recording available on our website, so you'll be able to see that. And I see that there have been some folks who have noted that they are doing age-friendly tech talks in their community, so that's a great start, and some requests for certain webinars that we might do in the future. So we've taken note of all of those things. Really great feedback from folks. I just recognized that we're close to the end, so I wanted to acknowledge those comments. I'll pass it to you, Rayanne.
Thank you. I'm just pulling up my slide deck here. Yes, there's lots of great suggestions, and I do like the idea of doing one on health records, because I think there's a lot of it's hard to navigate some of the new technology. I know, like even showing the QR code, there were some people who didn't understand what to do when you sold that medicine. So, it's hard to get up to technology and how everything works, because everything is so different and changing daily and trying to keep up to things. So we'll look into that. We just did a webinar on helplines and all the different sources out there. So somebody just mentioned that there's different forms of finding your e-records that are out there depending on where you live. So maybe that's something that we can take into consideration. So I did want to just wrap up just to let people know there's a couple sessions before the year end that we're hosting. One is actually happening tomorrow, and it is on reporting of elder abuse. So looking at reporting and disclosure and ethical responses. This is a free session. Goes from 9:30 till 2. You can join at any time that you want. I have the link and we'll post that also in the chat box after. So if anybody's interested, again, it will be recorded for those who register. You can look at that and it'll be posted after. We also have our last series of our tax talk series on estate planning, administration of estates. So that will be our last one of 4 that we've held. And finally, a reminder of our evaluations, as it is so important for us to get your feedback. These great suggestions that everybody's had today would be great just to put in that box in this evaluation, so don't forget what your suggestions are, and that we have that on hand when we go back to review our future planning. And lastly, just our contact information at Elder Abuse Prevention Ontario. Again, both age-friendly outreach as well as our organizations both have social media accounts. We post regularly. You can contact us on our websites, which we posted in the chat box as well. And yeah, so that's, I'm not sure, Cheryl, if you have any final words to say?
No, just thank you to everyone for attending, and thanks so much to Chelsea and John for your interpretation as well.
Yes, thank you all. And we are just taking notes of everyone's comments in the chat box, and everyone's appreciative of both your presentations today. And so we thank you again, and we'll have everything posted on our website. Just give us at least a day or two to get everything uploaded, and it'll be available. You should receive a link from Zoom that will have a link to the websites where you can access the material. So thank you again and have a great day.
Thanks, Rayanne.
Thanks, Madison. Cheryl.